Hello, dear friends. Dr. Harold Benson here, a physician with over 30 years of experience treating people over 60. Today we'll talk about a product you've surely known since childhood. It's loved in villages and big cities alike, eaten for breakfast and dinner, and added to pies and serniki. It's a product that, one might say, retains the power of milk, but in a lighter, more digestible form. Of course, we're talking about cottage cheese. At first glance, it might seem like there's nothing special about cottage cheese. A white lump, sometimes dry, sometimes soft and tender. But it can be a true cure for older adults, especially those who want to maintain strong bones and protect themselves from fractures and osteoporosis. Let me tell you a story. A few years ago, Mrs. Elizabeth, 72, came to see me. She complained of back pain and weakness in her legs. An X-ray showed osteoporosis, a disease of age that causes bones to become brittle. Elizabeth said, "Doctor, I'm afraid I'll fall. What if I break my hip like my friend?" She never got back on her feet again after the fracture. When I asked about her diet, it turned out she barely ate dairy products. She had trouble digesting milk, and she found cheese too fatty. So I suggested she try a simple step. Add cottage cheese to her diet, at least 100–150 grams a day. And the results surprised even me. After just 2 months, her blood tests showed improved calcium levels, and her back pain subsided. Since then, I often tell my patients, cottage cheese can be your simple and affordable cure for old age. In this video, I'll explain the benefits of cottage cheese specifically for people over 60, how to choose it, how much to eat, and what form it's best absorbed. Finally, I'll give step-by-step recommendations on how to use cottage cheese to strengthen bones and slow down the aging process. When we talk about health after 60, 3 things come to the forefront: the heart, the brain, and the bones. Bones are often neglected until a fracture occurs. The statistics speak for themselves. 1 in 3 women and 1 in 5 men over 65 experience osteoporosis. This means bones become as fragile as glass, and one wrong move can result in tragedy, a broken hip or spine. But we have an ally that helps keep our bones strong. It's cottage cheese, a simple product available to everyone. Why is it so important after 60? Let's break it down point by point. We all know that calcium is essential for strong bones, but few realize that not all calcium is absorbed equally. In tablets and supplements, it can be deposited in blood vessels or kidneys, but the calcium in cottage cheese is in an easily absorbed form. The unique feature of cottage cheese is that its calcium is bound to milk protein. This form helps the body absorb up to 80% of the calcium, while only 20–30% of regular supplements is absorbed. That's a huge difference. Moreover, the calcium in cottage cheese not only strengthens bones, but also improves muscle and nervous system function. This is why people who regularly eat cottage cheese are less likely to complain of cramps and weakness. After age 60, muscle mass begins to decline, a process called sarcopenia. People become weaker, their gait slows, and the risk of falls increases. Cottage cheese is rich in protein, which is especially important for older adults. 100 grams of cottage cheese contains about 16 grams of pure protein. This is the building block for muscles, ligaments, and skin. I often notice that patients who eat cottage cheese for breakfast or dinner feel more energetic. Their mobility improves, and even their mood improves. After all, protein is needed not only for muscles, but also for the brain. Calcium without vitamin D and phosphorus is useless. It's like bricks without cement. And here again, cottage cheese comes in handy. It contains both phosphorus and a little vitamin D, which improves calcium absorption. Of course, Cottage cheese doesn't contain as much vitamin D as we'd like, so I always advise patients to combine it with sunny walks and sometimes supplements. But even when paired with phosphorus, cottage cheese becomes a vital food for bones. Many older people are afraid of dairy products, thinking they raise cholesterol. But this is a myth. Low-fat cottage cheese, on the contrary, is good for the heart. It contains potassium and magnesium, minerals that regulate blood pressure, improve heart function, and reduce the risk of arrhythmia. Furthermore, the protein in cottage cheese helps repair blood vessels and strengthen their walls. Interesting fact, cottage cheese contains the amino acid tryptophan. It is involved in the production of serotonin, the hormone of joy and calm. Older adults often suffer from insomnia, anxiety, and fatigue. A small serving of cottage cheese for dinner can help you relax and sleep better. And in the long term, it can reduce the risk of depression and cognitive decline. After 60 years, metabolism slows down, and every extra kilogram puts a strain on the joints and heart. Cottage cheese is a low-calorie product, especially in the low-fat or 5% fat versions. It provides long-lasting satiety, doesn't spike blood sugar, and helps with weight management. Patients who replace evening sweets with cottage cheese and fruit notice a lighter feeling and reduced weight within a few weeks. It's time to dispel several misconceptions that prevent older people from including cottage cheese in their diet. Myth 1. Cottage cheese is difficult to digest. On the contrary, it is much easier to digest than milk. This is why it is recommended for older people who may experience discomfort from milk. Myth 2. Cottage cheese causes kidney stones. This is only true for those with pre-existing calcium metabolism issues. For most people, cottage cheese is safe and, in fact, helps normalize mineral metabolism. Myth 3. Only full-fat cottage cheese is healthy. In fact, any cottage cheese is healthy, as long as it's natural. Low-fat cottage cheese also retains calcium and protein, but it's lower in calories. The question I hear all the time is, "Doctor, how much cottage cheese do you need to eat to have strong bones?" The optimal amount is 100–150 grams of cottage cheese per day. That's about 3 to 4 tablespoons. This is enough to cover a third of your daily calcium requirement. I recommend eating cottage cheese in the morning or evening. In the morning, it gives you energy and protein. And in the evening, it helps you relax and sleep better. Store shelves are overflowing with different packaging options. Low-fat, farm-prepared, whole grain. Which one should you choose? Look for a product with a minimal composition, milk and starter culture. Avoid cottage cheese with added sugar, flavorings, and oils. It's a dessert, not a healthy food. For health after 60, it's best to choose cottage cheese with 5 to 9% fat. It contains a balance of calcium, protein, and a little fat for vitamin absorption. To ensure that cottage cheese brings maximum benefits, it is important to combine it correctly. With herbs and vegetables for a light dinner. With berries or fruits for breakfast or snack. With honey and nuts like a natural dessert. You can also make casseroles, cheesecakes, pâtés, and even sauces from cottage cheese. I worked with Mr. Robert, 68. He was diagnosed with osteopenia, a precursor to osteoporosis. We didn't immediately prescribe strong medications, but started with nutrition, a daily serving of cottage cheese, walks in the sun, and physical activity. After a year, his bones were in much better condition than the doctors expected. And Mrs. Elizabeth, whom I mentioned in the introduction, avoided a fracture and regained her confidence in her movements thanks to cottage cheese. So, cottage cheese isn't just a food. It's a powerful tool for preventing osteoporosis and supporting the heart, muscles, brain, and weight. And what's especially great is that it's accessible to everyone. Dear friends, let's sum it up. Cottage cheese is a simple, affordable, and incredibly healthy product that can become a true ally for your health after age 60. It strengthens bones, helps muscles stay strong, supports the heart, improves brain function, and even helps with weight management. Let me tell you another story. A few months ago, Mr. James, 70, came to see me. He complained of weakness, back pain, and a fear of falling. Tests showed low bone density osteopenia. We discussed his diet and included a daily serving of cottage cheese, along with walks in the fresh air and light exercise. A few months later, Mr. James returned for his appointment. He was feeling better. His pain was reduced, his muscles were stronger, and he was walking with more confidence. And bone tests showed positive changes. His bone density had increased. And all thanks to a simple product, cottage cheese. It's important to remember, cottage cheese alone isn't enough for bone health after age 60. A comprehensive approach is needed. Physical activity, sunny walks, adequate protein, vitamins, and minerals. But cottage cheese is a key ingredient that can be considered a building block for your health. The rule is simple. 100–150 grams of cottage cheese per day. Preferably minimally processed, without additives, with fruits, berries, or greens. And your body gets everything it needs for strong bones, muscles, and normal heart function. Friends, take care of yourself today. Small but effective steps, like including cottage cheese in your diet, can prolong your activity, reduce the risk of falls and fractures, and improve your quality of life. If you found this video helpful, please give it a like and subscribe to the Senior Channel, Vitality Channel, and share it with your loved ones. Tell us in the comments, do you include cottage cheese in your daily diet? What form do you prefer, fresh, grainy, with fruit, or in a casserole? This was Dr. Harold Benson. Take care of your bones, muscles, and heart. After all, health after 60 starts with simple habits.